I think it's very impressive that over 100,000 patients have been treated with IMFINZI. The PACIFIC trial was paradigm shifting for us. I definitely love what I do. Working with cancer patients, being able to help them through their journey, provide comfort and compassion to patients and their families.
That 100,000 number kind of blew me away a little bit, kind of thinking about it. I had that wow response, if you will. The PACIFIC trial changed the standard of care. We're at a point where we have real-world experience with this approach.
As I began to read about IMFINZI, it gave me a lot more hope, reading statistics, people's experiences. It's made me a little more aware of the person I am and what I can accomplish. I'm proud to say I'm one of 100,000.
The journey that I went through, I was confident. I stayed positive. Over 100,000 patients have been treated with IMFINZI, and I'm one of them.
Celebrating the 100,000th patient treated with this treatment paradigm is wonderful.
We did it. We did it.
But you're the one that had to show up.
And it was because of you I did.
100,000 patients.
100,000.
100,000.
100,000.
Over 100,000 patients have been treated with IMFINZI.
Important product information. IMFINZI, Durvalumab, as a single agent, is indicated for the treatment of adult patients with unresectable stage 3 non-small cell lung cancer, NSCLC, whose disease has not progressed following concurrent platinum-based chemotherapy and radiation therapy, cCRT. IMFINZI, in combination with platinum-containing chemotherapy as neoadjuvant treatment, followed by IMFINZI continued as a single agent as adjuvant treatment after surgery, is indicated for the treatment of adult patients with resectable tumors greater than or equal to 4 centimeters and/or node-positive, NSCLC, and no known epidermal growth factor receptor, EGFR mutations, or anaplastic lymphoma kinase, ALK rearrangements. IMFINZI, in combination with Imjudo, tremelimumab ACTL, and platinum-based chemotherapy, is indicated for the treatment of adult patients with metastatic NSCLC with no sensitizing EGFR mutations or ALK genomic tumor aberrations. IMFINZI, as a single agent, is indicated for the treatment of adult patients with limited-stage small cell lung cancer, LS-SCLC, whose disease has not progressed following concurrent platinum-based chemotherapy and radiation therapy, cCRT. IMFINZI, in combination with etoposide and either carboplatin or cisplatin, is indicated for the first-line treatment of adult patients with extensive-stage small cell lung cancer, ES-SCLC. IMFINZI, in combination with gemcitabine and cisplatin, is indicated for the treatment of adult patients with locally advanced or metastatic biliary tract cancer, BTC. IMFINZI, in combination with Imjudo, is indicated for the treatment of adult patients with unresectable hepatocellular carcinoma, UHCC. IMFINZI, in combination with carboplatin and paclitaxel, followed by IMFINZI as a single agent, is indicated for the treatment of adult patients with primary advanced or recurrent endometrial cancer that is mismatch repair deficient, DMMR, as determined by an FDA-approved test. IMFINZI, in combination with gemcitabine and cisplatin as neoadjuvant treatment, followed by single-agent IMFINZI as adjuvant treatment following radical cystectomy, is indicated for the treatment of adult patients with muscle-invasive bladder cancer, MIBC. Immune-mediated adverse reactions, which may be severe or fatal, can occur in any organ system or tissue, including the following: immune-mediated pneumonitis, immune-mediated colitis, immune-mediated hepatitis, immune-mediated endocrinopathies, immune-mediated nephritis with renal dysfunction, immune-mediated dermatologic reactions, immune-mediated pancreatitis, and solid organ transplant rejection. IMFINZI and Imjudo can cause severe or life-threatening infusion-related reactions. Fatal and other serious complications can occur in patients who receive allogeneic hematopoietic stem cell transplantation, HSCT, before or after being treated with a PD-1/PD-L1 blocking antibody. Advise women not to become pregnant or breastfeed during treatment with IMFINZI and Imjudo and for 3 months after the last dose. The most frequent serious adverse reactions reported in at least 2% of patients with unresectable stage 3 NSCLC were pneumonitis or radiation pneumonitis, 7%, and pneumonia, 6%. The most frequent serious adverse reactions reported in greater than or equal to 1% of patients with resectable NSCLC in the neoadjuvant phase of the Aegean study receiving IMFINZI in combination with platinum-containing chemotherapy were pneumonia, 2.7%, anemia, 1.5%, myelosuppression, 1.5%, vomiting, 1.2%, neutropenia, 1%, and acute kidney injury, 1%. The most frequent serious adverse reactions reported in greater than 1% of patients with resectable NSCLC in the adjuvant phase of the Aegean study receiving IMFINZI as a single agent were pneumonia, 1.9%, pneumonitis, 1.1%, and COVID-19, 1.1%. The most frequent serious adverse reactions reported in at least 2% of patients with metastatic NSCLC were pneumonia, 11%, anemia, 5%, diarrhea, 2.4%, thrombocytopenia, 2.4%, pyrexia, 2.4%, and febrile neutropenia, 2.1%. The most frequent serious adverse reactions reported in greater than or equal to 1% of patients with LS-SCLC receiving IMFINZI were pneumonitis or radiation pneumonitis, 12%, and pneumonia, 5%. The most frequent serious adverse reactions reported in at least 1% of patients with ES-SCLC were febrile neutropenia, 4.5%, pneumonia, 2.3%, anemia, 1.9%, pancytopenia, 1.5%, pneumonitis, 1.1%, and COPD, 1.1%. The most frequent serious adverse reactions reported in at least 2% of patients with locally advanced or metastatic BTC were cholangitis, 7%, pyrexia, 3.8%, anemia, 3.6%, sepsis, 3.3%, and acute kidney injury, 2.4%. Serious adverse reactions in greater than 1% of patients with UHCC included hemorrhage, 6%, diarrhea, 4%, sepsis, 2.1%, pneumonia, 2.1%, rash, 1.5%, vomiting, 1.3%, acute kidney injury, 1.3%, and anemia, 1.3%. The most common serious adverse reactions in at least 4% of patients with advanced or recurrent dMMR endometrial cancer were constipation, 4.5%, and rash, 4.5%. The most frequent, greater than or equal to 1%, serious adverse reactions reported in patients with MIBC in the neoadjuvant phase of the Niagara trial receiving IMFINZI in combination with gemcitabine and cisplatin were pulmonary embolism, 1.9%. Febrile neutropenia, 1.5%, acute kidney injury, 1.3%, thrombocytopenia, 1.3%, urinary tract infection, 1.3%, and pneumonia, 1.3%. The most frequent serious adverse reactions occurring in greater than or equal to 1% of patients reported in patients with MIBC in the adjuvant phase of the Niagara trial receiving IMFINZI as a single agent were urinary tract infection, 7%, acute kidney injury, 3.7%, hydronephrosis, 2.1%, pyelonephritis, 2.1%, urosepsis, 1.8%, and sepsis, 1.6%. Most common adverse reactions, greater than or equal to 20% of patients with unresectable stage 3 NSCLC, were cough, fatigue, pneumonitis, radiation pneumonitis, upper respiratory tract infections, dyspnea, and rash. The most common adverse reactions occurring in greater than or equal to 20% of patients with resectable NSCLC were anemia, nausea, constipation, fatigue, musculoskeletal pain, and rash. The most common adverse reactions, greater than or equal to 20% of patients with metastatic NSCLC, were nausea, 42%, fatigue, 36%, musculoskeletal pain, 29%, decreased appetite, 28%, rash, 27%, and diarrhea, 22%. The most common adverse reactions occurring in greater than or equal to 20% of patients with NSCLC or pneumonitis or radiation pneumonitis, 38%, and fatigue, 21%. Most common adverse reactions greater than or equal to 20% of patients with ESSCLC or nausea, fatigue, asthenia, and alopecia. The most common adverse reactions greater than or equal to 20% of adult patients with locally advanced or metastatic BTC or fatigue, nausea, constipation, decreased appetite, abdominal pain, rash, and pyrexia. The most common adverse reactions occurring in greater than or equal to 20% of patients with UHCC were rash, diarrhea, fatigue, pruritus, musculoskeletal pain, and abdominal pain. The most common adverse reactions, including laboratory abnormalities, occurring in greater than or equal to 20% of patients with advanced or recurrent dMMR endometrial cancer or peripheral neuropathy, musculoskeletal pain, nausea, alopecia, fatigue, abdominal pain, constipation, rash, decreased magnesium, increased ALT, increased AST, diarrhea, vomiting, cough, decreased potassium, dyspnea, headache, increased alkaline phosphatase, and decreased appetite. In patients with muscle-invasive bladder cancer, MIBC, the most common adverse reactions, including laboratory abnormalities, in the overall study occurring in greater than or equal to 20% of patients, were decreased hemoglobin, decreased neutrophils, increased blood creatinine, decreased sodium, nausea, increased ALT, decreased calcium, decreased platelets, fatigue, increased potassium, decreased lymphocytes, increased AST, constipation, decreased magnesium, decreased appetite, increased alkaline phosphate, rash, pyrexia, diarrhea, vomiting, and abdominal pain. The safety and effectiveness of IMFINZI and Imjudo have not been established in pediatric patients. Please see the full prescribing information for IMFINZI and Imjudo at IMFINZIHCP.com for important dosage modification and management information specific to adverse reactions.